doing skill 1, which is ambulating with the gait belt. I'm gonna knock. Hand hygiene always first, always our first step. And this is just going to be a quick run through all of the skills. That doesn't mean I'm actually going to perform it. Don't forget that if you don't do something, you're not gonna get the point for it. So look at your mock skills packet and make sure you know each of those things you're gonna get points for. You're gonna come in, you're gonna say, hi, I'm Sarah, I'm your aide today. We're gonna be walking to the wheelchair. You're gonna bring the wheelchair over. In the bold is locking the brakes. So we're gonna lock the brakes, these brakes, and we're gonna make sure the bed brakes are locked. Just go over here, push the bed, make sure they're good. Then we're going to make sure we have our gait belt and our non-skid footwear. Pull the curtain. I would recommend pulling the curtain for everything. So I have this, and then I have my non-skid footwear, non-skid socks. So I'm going to go ahead and sit the person up, making sure their feet are level to the floor, flat on the floor. Sit them up, put the gait belt on, checking underneath for 2 fingers, right? Underneath to make sure it's not too tight but not too loose. Then we're going to help them stand. We're going to position ourselves like this, and we're going to help them stand on 3. Then we're going to have them walk in front of us. We're going to be slightly behind, hold their forearm, and walk 10 steps to the wheelchair. So you're going to have to put your chair a little further than this. Put them there, help them sit down. Always have them reach back. If you're having a resident get up, we never want them to push off of anything but their base of support. So you're going to walk them over there, sit them down in the chair, unlock those locks, take the gait belt off, give them their call light, ask if they need anything else, open the curtain, hand hygiene. Okay, so that's 1. Number 2 is going to be pretty similar. I'm going to knock, hand hygiene, introduce myself, tell them what I'm doing, and identify who the person is. So I'm going to say Frankie or Mr. Smith. And then they're going to, again, be sat up at the edge of the bed, non-skid footwear, gait belt. But this time we're going to grab a walker. Can I have that walker behind you? So with the walker, we need to make sure that we are positioning it in front of them. We're also going to be
Your foot.
stabilizing it with our foot or our hand. So if you use your hand, that's fine. I like to use my foot. I put both hands on the gait belt. Always make sure our back is straight. If you're like this at any point in the skill, I have a feeling you won't get points for body mechanics. So never go like this. So you're gonna lift them up, but lifting with our knees, and then having them grab this. Now again, when we're having a resident stand up to get up with a walker, we're going to push off the base of support. We're not gonna have them get up holding onto the walker. It's not stable, it's not good. So have them push off of where they are. You know what I mean? So like this. When I get down, like this. Never like this. Okay, so like this. And then again, walk them over, sit them down, boom, boom. In the bold is both brakes for that one. Number 3 is applying a 10 hose. I'm gonna have to get some more 10 hose because I don't see any. But we're going to uncover just the leg that we're doing. We're going to roll it down to the heel, right? We're gonna slide it on. So if this was a 10 hose, probably have one around somewhere. Up there. I'm gonna roll it down to the heel, slide it onto the foot, and then roll this up the rest of the way. Making sure that there's no wrinkles, making sure that you can check the toes and covering them back up. Then we're gonna put this back up, lower the bed because we definitely would have lifted it for good body mechanics, right? So give them the call light, lower the bed, you're good to go. Open the curtain, hand hygiene. That's 3. Number 4 is bedpan with output. So you're gonna knock, come in, hand hygiene, pull the curtain, introduce yourself, tell them what you're doing, you're gonna get your supplies. I don't like putting a bedpan on the side table, so I don't recommend doing that. I try to grab it last, but I'm gonna get a towel, a washcloth, washcloth, and my bedpan and toilet paper, right? So I grab my bedpan and I'm gonna put gloves on. So put my gloves on. I got my bedpan and my toilet paper. I'm gonna have Frankie lift his hips so I don't have to use the rail. I'm gonna lift the bed up and supine, because otherwise Frankie's not gonna be able to roll. So lift it up and flat, roll him over, always making sure that the handle is on the outside, right? We don't want them sitting on the handle. So I'm gonna place him on the bedpan, ask him to raise his hips. We don't need a privacy blanket for this, but you can. That's optional. So and it would be a real person on this one. So they would raise their hips up, you would put it under them, you'd say, okay, I'm gonna give you a second, give them their call light, give them their toilet paper, lift their head up so they can use the bathroom. It's kind of hard to pee laying down flat, I'm sure. I've never tried it. But put them up so they can go, give them the toilet paper, call light, you're gonna step away. The test observer is gonna say, they're done. You're gonna say, okay. You're gonna come back, you're gonna lower the head back down, supine, pull that out. You can then lift them back up while you're holding this in your hand. Then you're gonna lift the bed back down to low because you're about to walk away and go in there. You're gonna step over to the test observer. She's gonna pour some yellow water, it's food coloring with water, into your pan. She's gonna know how much is in there because she probably measured it. You're gonna go in here, you're gonna pour it into a graduated cylinder, one of the clear things. You're gonna set it down on there, read it at eye level. If you want, I would imagine it would benefit you to say it out loud. Say your number out loud. It's probably gonna help you remember it. Say it out loud so and then you're gonna rinse this out, dry it out, rinse out the cylinder, dry it, put it away. Before I take my gloves off, I'm going to help Frankie wash his hands because we wash our hands after we use the bathroom, right? So I'm gonna go get my washcloth, I'm gonna get it wet. You guys are gonna have both sinks. So you can get that wet. Just always make sure the water is not cold for stuff. So we got washcloth, and we're just gonna wash Frankie's hands. And then we're gonna dry them. We're gonna have to get some towels. Okay, so get rid of that. Always making sure that we're stepping over to here, pushing on that and putting the linen in, never throwing it on top. Then we're gonna dry between the fingers. Then I can take my gloves off. Now I'm going to record my output. Then, which she's gonna have on a table somewhere. She's gonna have the paper out for you. Then, what's the last thing I'm gonna do? Wash my hands. So go in there, wash your hands, and then you'll leave, exit. And you can put the toilet paper away too. So that's 4. Number 5 is catheter care. You can see my video on YouTube for that one, but generally we're just, if this is the catheter, we're just gonna hold it and we're gonna go down, flip our rag, down again, flip our rag, down again. And that's 3 times. Wash. Then get a new rag, we're gonna rinse, hold the catheter near the urethra, pull it down, flip, pull it down, flip, pull it down, flip. Then you're gonna pat dry.
Are you having class now?
We're doing a study session
Ah.
because our test is tomorrow.
Oh,
What do
good
you
luck, everybody. To see what's in here, if you don't mind.
Yeah, I don't know.
Sorry.
I'm moving stuff. I need that to go somewhere.
You need this to go somewhere?
Yeah.
I thought.
Even if it's in the bathroom. I mean, because I think we're using this one. It doesn't matter. One or the other.
One of
needs
the.
to go.
Okay, that's fine. That's fine.
So, are you still recording? Sorry. So, that's 4 and 5, right? So then 5 we would pat dry. We're all good. We're also going to use a waterproof pad for catheter care. So we would lift the bed up, put the rail up, roll Frankie, put the waterproof pad, clean the catheter, like wash, rinse, pat dry, pull the pad out, put the rail back up, clean our supply, like lower the bed, clean our supplies, put it away, and we're good. But I forgot one thing. When we're doing catheter care, what are we also going to check for?
Kinks.
Kinks. Always checking for kinks because we need to make sure it's getting into the bag. So for number 5, do not forget that you need to verbalize. I checked the tube. There are no kinks. Okay? That's the only skill you have to do that for. So if anything, don't forget that. So that's 5. Number 6 is changing a male brief. We've been over the TTBB, right? 7 took my class too. So T, flip, down the top, flip, down the bottom, flip, scrotum, flip. That's our wash. So we're gonna do the same thing for rinse. So we're going to go around, flip, down, flip, underneath, flip, scrotum, flip. Then we're gonna pat dry. Then we gotta do the butt, right? Don't forget that butt. I get worried that you guys are gonna clean the front and be so happy that you did it right, and then you're gonna forget about cleaning the booty. So make sure you grab 4 washcloths, 2 towels for this if you want. You can get 1 or 2 towels, because then I think you'll remember to dry it. You know, you won't get, in case you accidentally get rid of it the first time. So you would wash the front. But before we wash the front for a male, we're gonna make sure that we get rid of our brief, right?
Yeah.
So we knock, come in, introduce ourselves, get our supplies, get a clean brief, get our rags, everything like that. Cover Frankie up with a privacy blanket, remove that old brief. Now we can start the TTBB, do the front, do the back, then you can put him on his side, do the back, up the butt, right? It's, what did we say? Up the crack. I can't remember. Front to back, up the crack, okay? Never forget that that's the direction you're going. If you go the opposite direction, you will fail. We always want to go away from our openings, because if it's an opening, we want to make it clean, so get everything away from it. Then we're going to wash the butt, 2 butt cheeks, up 1, up 2, dry it, remove that waterproof, well, put the clean brief, remove that waterproof pad, cover him back up, remove the privacy blanket, lower the bed, put your supplies away, and you're done. So, and then hand washing, right? But we're gonna open our curtain and everything before hand washing. Next is 7, dressing a bedridden resident. We're gonna use a privacy blanket, cover Frankie with the privacy blanket, remove the old gown, removing from the stronger side first, or the unaffected side. Then we're gonna remove the other side, come around to the other side, remove it, get it out of the way. While Frankie's still covered, you're gonna start putting on his clean clothes. You're gonna dress with the affected side or weaker side first, dress that, go to the other side, dress it, all, while still being covered with the privacy blanket and the bed's up in the air. Then you're gonna do the pants in the same fashion, starting with the weaker side first, then you're gonna do the socks, okay? And when we're doing the pants, we're gonna roll them up, and then we're gonna push the person on their side and try to get them out over their hips, right? So that's dressing them, and then we can get rid of the blanket and we're done. The next thing is gonna be 8, which is emptying your urinary drainage bag. So knock, hand hygiene, pull curtain, get our supplies. You can put our gloves on, get a barrier, put this down. We're gonna lift the bed up. We're gonna grab that, we're gonna already have that cylinder, set it down, empty it, right? We cannot let that tube hit the inside, let it drain, clean it with alcohol, pad once.
Are those gonna be there?
Yep, they're gonna be right here. And then you'll put it back. Once you put it back, you're gonna lift the bed down, lower the bed down. And then from that point, you can go in there and measure it, and you can get it eye level. You can come back for this, or you can get rid of it at the same time, whatever is easier for you. If we drop linen, don't forget that we're gonna pick it up at the end, because we don't wanna get our gloves dirty, or our hands. So you would do that, come back, give Frankie his call light, record the output, and then wash your hands. Well, and open the curtain, then wash your hands. So that's 8. We're recording in what measurement? mLs, yes. 9 is hair care. Make sure that we come in, knock, introduce yourself, put that towel on them, ask them how they want their hairstyle. Okay, Frankie, blah, 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 or, you know, it's gonna be a different person. Then you're gonna remove it. You're gonna say, do you like how you look? Because we do have a hand mirror. You're gonna say, yeah, that's good, okay. Give them their call light. Don't forget, Frankie or your patient is real clumsy. They drop their call light in the middle of every skill. So at the end of every skill, we gotta make sure that they have it, because they probably dropped it. Hair care stuff put away, open the curtain, exit. Well, hand hygiene, exit. 10 is occupied bed. You're gonna get all your supplies. You're gonna lift your bed up. You're gonna put the rail up. You're gonna lay it flat. You're gonna roll them over, remove the old stuff, put the clean stuff down, pull your rail up, have them roll to their back. Go around to the other side, put that rail down, then roll them to their side, pull that stuff out and adjust. Use a privacy blanket for occupied bed. pillowcase last. And if you really want to be particular about it, what direction are we going to put the pillowcase? Facing away from the door. Away from the door. If you really want to get particular about it. If you were to be asked a question, the opening of the pillowcase is away from the door. Alright, so that was occupied bed. So, and then you can also do a comforter too. Please don't forget to put a new comforter on. And you're gonna do your hospital corners. If you wanna come over here, I'll try to do them. Try to. I'm just gonna do it with this flat sheet. So, we're gonna tuck it in. And then I just pull this up a little bit, tuck everything underneath. And then when it comes back, it'll be tucked in. It's gonna be a lot neater than that though. Please make it a lot neater than that. But you get the concept. So you put it over, tuck it under, pull this up, tuck it in, and then it's gonna be nice and neat. You're gonna have a lighter corner. If you don't know what it is, look it up. So that's occupied bed. Lower the bed back down, open the curtain, and hygiene. 11 is nail care. We're gonna come in. If you want, you can put a towel down here, get that basin of water. Even if you're the first person, or maybe you took a break, if it takes a minute to get that water warm, give it a minute to get warm. Have them soak. You look at the tester, you say, I would soak for 5 minutes. After that, you're gonna get that wash rag. You're gonna push their cuticles back. Then you're gonna dry their hands.
Which one we use, the small one?
Yes, I always use the little one. Yep. That big one I don't use. I think that's just a little too hard, like if the person couldn't get their hands up in there. So, and we're only doing one hand, right?
Yes.
And then, so dry it, file, like clean them, right, with the orange stick, file. Orange stick goes in there. And that's it. You put your stuff away. So then 12 is peri-care for a female, so we're gonna make sure that we're doing waterproof pad, privacy blanket. You come in, you put that stuff down, and then you're gonna get your basin, your soap, your 4 rags, and 2 towels. Get this wet, put some soap on it with your gloves on, bring this out. When you clean the female, you're gonna, I always hold the labia and I go down the middle, flip my rag, side, flip my rag, side, flip my
Do
rag.
we have to announce that we're going down the Olivia?
Nope, that is not listed,
Okay.
but you can if you want. Then I'm gonna get my rinse, so same thing again, but it's gonna be no soap this time. So I have this, and I'm gonna go down, middle, flip, side, flip, flip, okay? And then you're gonna pat dry.
Then wash.
Then you're gonna wash that booty. Flip them over, wash the butt, 2 butt cheeks, so at least make sure you wash the butt
I do
twice.
3 times.
You can do it 3 times for safe measure, that's fine. Pat that dry, roll that waterproof pad up, bring them back, remove the waterproof pad, remove the privacy blanket, lower them back down, put your supplies away, open your curtain, wash your hands. Well, sorry, call it, then wash your hands.
We're supposed to wear PPE for that?
Nope.
No.
The following with PPE are gonna be the next one. So 13, which is bed bath. So I'm gonna come in, and the 13, 14, 15, and 16 are all on YouTube, the ones that I listed. So make sure you watch those tonight if you need to, but you come in, hand hygiene first. I'm gonna put my PPE on. So pretend I put my gown on, I'm gonna put my gloves on, I'm gonna put goggles on, or gloves. Then I'm gonna, I had to think about if I did it right. Grab my supplies, so we're gonna get 3 wash rags, 2 towels, 1 gown. So get those things, then I'm gonna lift the bed up. I'm going to clean Frankie's face with just water. Pat it dry, get rid of that rag. Put the towel underneath his arm, and then get another wash rag with soap, go down, flip, hand, flip, under the arm, get rid of it. Do the same thing again, but rinsing. And then pat dry. You can use the towel underneath if you need to. Then, sorry, I missed an important step. You needed to remove the gown first. So we'd use a privacy blanket for a bed bath. our first step would be to put that privacy blanket, remove the gown. They're not gonna have an unaffected side, but we're gonna take that gown off, get it out of the way, then give them a bed bath. Then put the clean gown on. Then position them, call light, open the
Use
curtain, remove your
Chuck.
PPE on, remove your PPE, no, and then hand hygiene. We don't use a chuck. The only time we use a chuck is if we're doing pericare for a female, pericare for a male, calf care.
Okay, sorry.
I think that's it. I will also get clothing protectors, so we have clothing protectors. So that was 13. 14 is denture care. Make sure that you're emptying and rinsing that basin. Watch that video. And make sure you give Frankie his call light before you leave. Open that curtain, then take your PPE off, then hand hygiene. What order do we put our PPE on?
Gown, gloves,
Gown,
or goggles, gloves,
Gloves, and we take it off.
gloves, goggles.
goggles,
Down. Very good. So 15 is feeding, right? So when you feed, you need to verbalize their tray is correct. Yep. Make sure that everything matches. You're gonna put a clothing protector on them. We're gonna wash their hands before they eat. If you start feeding them and you forget, you don't get that point. So you could always start over, or just accept that you don't get that point.
Are they gonna
But-
have real food?
Yes, it would be like pudding. So do those things. Feed. Offering the fluids occasionally. Tell them what you're putting in their mouth. That's another thing. Like say these are green beans. Here you go. These are mashed potatoes. Here you go. Not that they are going to be, but wipe their face. Get rid of everything. Document. Then open the curtain. Remove your PPE and do hand
Please
hygiene.
document the drinks.
Yes, and it's gonna look like that one in front of you. So make sure you look at that. It's gonna say like glass 1, glass 2. You can write like how many ounces or whatever, and then you would add it up. But you need mLs, so you're gonna have to do math.
So, are we like putting our own thing on there, or what? Like for the glasses?
I'm here.
Are they gonna?
No,
Yeah,
I
I
think they
know.
would give you a scenario, so they would be
Okay.
like 50%, or
Okay.
maybe she's gonna start with them full, and then she'll dump it out and say how much did they drink. So that's feeding. The next one is brushing teeth. I want a toothbrush.
Where's those choppers? She came and got me and showed me with that one at work.
I'm gonna show you. Alright, well. I know we have them, but. What is this? So. We're gonna do, for washing or brushing their teeth, we're gonna do knock, hand hygiene, put our PPE on, come over, put a clothing protector on them, get the toothbrush wet, put some toothpaste on. We're gonna have them sitting upright. And then what I say is we're gonna have 9 different sections that we're gonna clean per level,
Yes.
if you wanna be real thorough. So it's gonna go 1, 2, 3, 4, 5, 6, and then on the inside, 7, 8, 9, okay? So that was the top. Then we would do the bottom. 1, 2, 3, 4, 5, 6, 7, 8, 9. And then brush the tongue. Have them rinse, have them spit, wipe their face, leave them in a good position, put your stuff away, and you're good to go. So that's 16. Now 17 is positioning a resident in bed on one side. You're gonna need 3 pillows. You're gonna come in, knock, hand hygiene, pull the curtain, lift the bed up, put them supine. You're gonna pull them towards you, because otherwise you're gonna put them directly out over onto the floor. So pull them towards you, position them on their side, and then place those pillows. Place it behind the back first, then underneath, like them between their knees, and then you can put one underneath their upside arm. We always want to make sure that that underarm is not obstructed when they turn and they're laying on it. We also wanna make sure that, so like as soon as you flip them, say, is your arm under there okay? Check that first. We also can never let their face become obstructed. Then you're gonna lower them back down. They're gonna be laying, you know, probably flat, and then lower the bed, give them their call light, and lower the rails, okay? 18 is range of motion. We're gonna come in, knock, hand hygiene. Get in the hang here. Then we're gonna lay the bed flat. Do our range of motion for our arm. 1, 2. Any pain? No. Do it again. 1, 2, 3. Any pain? No. Okay, we're good. Thanks. Have a good day. That's literally it. And then for the leg, it would be the similar thing. Just doing the leg. 1, 2, 3. And then going out, they would be laying in the bed, of course. 2. Any pain? No. 3. Okay, we're good to go. Thanks. Have a good day. 20 and 21 are gonna be those stand pivot transfers. We're gonna bring the wheelchair close. We're gonna put that gate belt on them. They are not going to be able to help us because we're pivoting them. So we're gonna have, this is the one where they can put their arms on our shoulders. So we can have them do that. We're gonna hold the gate belt, we're gonna stand them up, pivot them, and sit them down in the wheelchair. Making sure that before we do that, brakes and brakes are locked, okay? Same thing for the next one, it would just be going from the wheelchair to the bed. If you're putting them into the bed, we need to remove their footwear. And each time, make sure they have their call light. And the 22 is vitals. You'd come in, knock, hand hygiene, introduce yourself. Then you're gonna say, okay, I'm gonna check your heart rate. And then you're gonna look, you're gonna get a feel, look at the clock, wait until it's somewhere that you can remember for 60 seconds, say start, and you're gonna do it for 60 seconds. And then you're gonna say stop after exactly 60 seconds. And then you're gonna record your number on there. Then you're gonna say, okay, I'm gonna do your respirations. And then, or you could say, I'm gonna do it again, and you can just hold their wrist and actually count their breaths. If you want, say start, wait 60 seconds, actually count, stop, record it, thank you. If you need anything, here's your call light, have a good day. Open the curtain, hand hygiene. You can record.